Good morning, we're glad you're with us today. I'm Tina Massengil and I work for the Kentucky Department for Public Health as a Regional Preparedness Coordinator.
And my name is Margaret Hibbs and I also work for the Kentucky Department of Public Health as a Regional Preparedness Coordinator.
What a lot of people don't realize is that public health is now considered a first responder and that we have a lot of responsibilities when it comes to that, from the state level all the way down to the local level. And today what we're going to do is we're going to look at those responsibilities and kind of get a better understanding of what does that really mean. In other words, what are the nuts and bolts of preparedness? To understand what's going on, to understand the nuts and bolts of preparedness, you're going to have to understand preparedness or response to begin with. And what we look at is, how does emergency management handle an event? How do they take care of their community? And what they look at is about 15 different areas in a community. When an event happens, they want those 15 areas back up and running so that community is up and doing well. Okay, so for instance, if we've seen a snowstorm before, in a snowstorm, what are we worried about getting back up to? When it snows, you want to know, can I get out of my driveway and can I make it to Walmart, right? So what is that? That's transportation. Also, another thing you want to know is the electricity still on? Because if it's not, Walmart closes and we're in trouble, right? And the other thing is we want heat and we want water. So when you look at that, that's the first three emergency support functions. Is transportation happening? Is communications happening? Are public works working, okay? So those are one of them, or the first three of those emergency functions that emergency management wants to make sure is happening for a community. The next thing that happens is there's also what's called ESFA, number 8. Well, that's us. We're number 8. We're public health. And when you think about that, it's what the concern is, not is the health department up and running, but is the healthcare system for that community up and running. That could be the ambulances, that could be the hospital, that could be long-term care. We're looking at, is that whole component up and running and going good? So that's ESFA, and that is, a lot of times you're going to hear us call ourselves the ESFA coordinator. In fact, for the state of Kentucky, the Kentucky Department for Public Health is the ESFA coordinator. So that their concern when an event happens is the entire health community of Kentucky. Okay, next slide. All right. When you start getting into all of this, there is a lot of classes you can take. There's a lot of things that you can learn. There's flow charts. There's all kinds of stuff. And it can get really down in the weeds. Guess what? We're not doing any of that today, fortunately. We're not going to worry about all of those big terms or the big flow chart. What we're going to try to do is stick to the very essential, the nuts and bolts of this, so that everybody can have a good general understanding of what preparedness does and how it works. Okay. So what we are going to be looking at today are, what are the events that we respond to? What about our employees as public health or local health departments? What about our business continuity? How do we keep on going? And what about the local health department roles? We're going to look at all of that today.
And then I'm going to pick up, when we talk about the state roles, what exactly does the state track, the resources that are available to a local health department from the state, tracking the cost and what it all entails in doing that, going back to normal, so after the event's over, how do we get it all back, what you should know up front, and then putting it all together.
Okay, the first thing we're going to look at is, what are the events that as ESFA we're going to respond to? And a lot of the times, if you keep in mind, ESFA is all of our healthcare system in our community. Is it up and running? When you think about a flood or an ice storm or a tornado, it's easy to figure out how that could affect an ESFA. If that tornado hits the hospital, you have got a problem in that community. You're going to have to get in there and help for that, because that health service is out of whack, right? Okay, so some of the times, and when you think about the man-made one, the anthrax attacks, all health department employees know, we're the ones who are going to push the pills out to the people. If we have to respond to a disease, that medication is probably coming through public health, and it's going to be our responsibility to get it out to our communities. So that part, we can see how we would respond there. Some planned events, when it's the NASCAR or the Derby, a lot of times we're there doing surveillance, and also we're concerned about if an event happens and everybody starts to get sick, what will happen to that hospital? It's going to get overflowed. It's going to have too much of a surge. Can they handle that capacity? What are we going to do with those extra patients? So again, those are the times that we're going to be coming around and responding in an event. Now, what about a dirt slide? What about a rock slide that takes out a road? Does that seem like something the health department would be responding to?
I have a question.
Sure.
I'm not a preparedness staff member, so why do I need to know this stuff?
Well, because every health department has, every member of a health department could be asked to help somehow in a response. You might not be a preparedness staff member, but back to this anthrax, when we have to set up a clinic that takes care of everybody, you might be asked to help move the boxes, help set up the clinic. You might be asked to take patients. You might even ask to be something as simple as a greeter. You just smile at the people when they come in and show them which direction to go. But you probably will be playing a role in it. And all health departments have been asked to what we call tier their employees. That means kind of look at them and decide in a response what would they be doing. And even the lowest level of tier still needs to be trained and have an understanding of what's going to happen, because almost everybody will probably help, especially in a smaller health department. You just don't have that many people, all hands on deck, right? So you probably are going to be asked to do it. You know that when the right slide happened, it doesn't sound like it'd be something that we would be involved in. How's that going to hurt our healthcare system? Well, for this one community, the road that got knocked out actually was a road that led from one side of the county to the other side of the county. And when that one road got knocked out, instead of only taking 20 minutes for EMS to get over to people, it now was going to be an hour and a half for them to go all the way around and get to them. So even though that doesn't seem like something we would respond to, it still affected the healthcare system in that community, and ESF8 still played a role in trying to help work out how are we going to fix this, how are we still going to take care of everybody. So when you're thinking about that, we do play a lot of roles in a lot of different responses on different levels. Okay, next question is if you get response, if you're a health department employee, as you said, and you've been asked to respond. As an ESF8 response, the health department is going to be worried about your health and your safety. And part of them knowing that you're okay and you can help respond is that you have a family response plan in place. And a good place to go to get one of those and to know how to do that is called ready.gov. It's a great site, and it'll help you get your plan together to know what you need to do so that your family is safe and ready when an event happens. And once you have them taken care of, you'll be more likely to be able to come and help respond with public health. Accountability is one of those things that we, as an employee, we need you to do, and that is a lot of times we're going to be asking you, make sure your number and your address is correct in the personnel office. When we put out those phone trees, for emergencies, make sure your number is correct on there. If you're on the Health Alert Network system, you might need to go in and double check and make sure all your information is correct, because that's a part of accountability. That way we can get a hold of you if we need, and to tell you what needs to happen or what has happened and how we're going to respond, how we're going to help. Also, the other thing that the health departments look at is during an event and a response, you might not be able to, the restaurants might be closed. You might not be able to get back home. So they're also going to take care of your needs like that. They're going to look at being able to feed you if they've asked you to come in and you can't get meals a regular way, make sure that you have a place to rest and be taken care of. And then stress levels, that's another thing that they're going to be asking you to look out for yourself and to be looking out for the other people that are working, because in these responses and events, it can be a very high stress situation. So a lot of times you're going to be given some just-in-time training on what to look out for and how to handle some of that.
How do I know if I need to respond to a disaster?
Well, that goes back to accountability, and you will need to follow whatever your health department's policies and procedures are on, as Tina said, keeping up with your phone. If you've changed your phone or you've changed your home address or location, you need to make sure that your supervisor is well aware of those changes. And then also look at your health department's org chart. Who is your direct supervisor? And find out in the event that you are used because of a particular skill set that you have. Typically you don't work in disasters, but for some reason you have a skill set that's needed in this disaster, you may have a different supervisor. So you want to kind of know in what kind of situation who your supervisor is going to be and that they have all of your information. So definitely keep your phone records, your HON, your Health Alert Network account up to date so that your supervisors can get a hold of you. Great questions.
Mm-hmm. Good deal. Okay, the next thing we're going to look at is called business continuity. When you think about this, for small businesses, when you talk about this, what we want them to know is you need to have a plan in case that disaster happens to you. Your business won't go under because you might not be able to get back up and running quickly. Well, with the health department, it's really the same thing. We don't expect to not ever to get back up and running, but the problem is we have a lot of services that we provide that are essential to our community. And we have to make sure that some of those are by law that we have to provide them. Some of them are just by the fact that without it, a lot of our community members will suffer. So we have to recognize that every health department has what we call a COOP plan. It is a continuity of operations plan. A lot of times we call it COOP, and sometimes we think it's for the birds, but it's really not. A lot of planning goes into it. And what it really has in there is it's telling us if something happens to our building, where are we going to go? Have we got arrangements made with someone else that we can move all of our stuff there? What stuff would we have to get up and running again? We also do something with essential services. Basically, we take all of those services that we provide and we assign a amount of time that we could go without doing them. Some services, we got to be back up the next day within a few hours and going. Some services, we could wait 3 weeks to 4 weeks before we had to do them again. But what we do with that is we know the ones that have to be back up, how we plan for that and how to get them back up and running. So that even if you go in tomorrow and your building has flooded and you can't get anything out, you're still going to know what services you need to get up and how to do that and where you're going to go. So that's what the COOP plan is. It's about how do we keep things going, how do we move, what do our staff need to do. So if you haven't looked at your COOP plan, it'd be a good idea at some point to kind of pull it out and get familiar with what your plan is. Okay, so in a response, public health or whoever the ESF 8 coordinator is, when we get ready to respond with local health departments, one of the responsibilities we have is communications. The health department needs to know how to communicate with their staff, with their other partners, with that's emergency management, the hospitals, the long-term cares, and also with the state. Because you want to be able to get back a hold of the state health department because they have a lot of resources that you might need to be requesting. And that's one of the things that we have on there, is that we have to be able to know how to ask for help. Locally, we start out asking for help among our community. So if you have 2 hospitals in your community, something goes down with one, you want to think in an event, oh, that other health department, that other hospital is not going to help them because they're in competition. Well, that's not true. Hospitals are concerned about the health of the community, and they're willing to help one another in an event to take care of the community. So you might have to look locally and let them borrow something from each other. If you don't have it locally, you might want to look in the next county. If that's not happening, you might need to be calling the state and getting the state resources in. Emergency management can help with these local resources, and then also the state can help with them too. A lot of things, another responsibility that we have is, we already talked about making sure that our essential services keep going. And the other thing that we've got to be able to do is surveillance. That's one of the big things that the health department is known for. We keep an eye on the diseases. We watch. We make sure that it's not an outbreak of anything. Make sure it's not something that has come in that no one had known about before. We do a lot of community health and medical services. Anytime that the other responsibility that a local health department has is to fill in the gaps. So as they are looking in that healthcare system and they see, okay, after this event, we don't have any mental health because that's the building that got destroyed by the tornado or whatever happened, and all of those people are taking care of trying to get that back up and running. We might be calling for the state to help bring us in some more people to help with mental health. So that's kind of it. We're filling in the gaps.
During the ice storm, our phone service was out. If that should happen again, how am I going to know what to do?
Well, one, you want to definitely look here again at your local health department's policies and procedures. Some local health departments have their staff respond to whatever the nearest local health department is in their community at that time. Some actually have it where they put it out on the televisions or the local radio stations saying all local health departments go to this location. This is our alter location that we'll be working on at this time. So you'll want to definitely look at your policies and procedure manuals, discuss that with your supervisor, and then follow through on what your health department has decided to do. All right, well, I guess I get to take over now, Tina, thank you. I'm going to step over here so that I can see the screen as I'm talking. The state role, the state has what is called a Department of Operations Center, or also is now being called the State Health Operations Center, which is called the SHOC. And everybody needs to know how to contact the SHOC. There isn't actually an email dedicated to be able to contact individuals at the state. Also, it's very important to know how to communicate with your state representatives. We have satellite radios, there's the Health Alert Network, we have My Talks, we have emails and phones so you can contact your state representatives. Also, the state has provided individuals within all of our regions, which are called Regional Preparedness Coordinators, Tina and myself are two of those individuals, to help have boots on the ground in each region to where if there is a situation, those individuals can very quickly respond to what's going on for the local health departments and send that information up to the state. The state can also, if requested, come in and assist with coordinating the response. Only if a local health department needs the state to come in, at their request, the state will do that. Now, the state can provide many things when they're coordinating response. They can provide additional manpower. If a local health department has responded to the event for a long period of time and their staff members are just depleted, they're exhausted, they can provide additional manpower from another local health department, from someone from outside of the state, or from somewhere here at the Kentucky Department of Public Health. They can also provide a lot of resources, communication equipment, personal protective equipment, communication equipment, just trailers for different types of things. So there's a lot of resources that the state has that is really not feasible for a local health department to house all the time and wouldn't be using all the time. So you can access those state resources if needed. Also, the Kentucky Department of Public Health can provide up-to-date, most current information such as press releases, so you're not having to waste your time doing that at the local health department. And can also provide ITVs, joint meetings, conference calls to provide the most updated information, say if there was an outbreak, some kind of guidance that needed immediate assistance with. The state is also responsible for tracking certain types of things, such as injuries. They also track deaths using the mortality data management system. They use their regional epidemiologists, like Tina said, for surveillance and tracking illnesses. In the shelters, they'll use their environmentalist to make sure that everything in the shelter is set up properly and everything is being watched and disease does not break out within inside the shelter. They'll also use their hospital preparedness coalitions to check if the healthcare facilities have any kind of damage. Any damage at a long-term care facility, any damage at a hospital during an event. They also will track what kind of staffing a local health department needs. Say, if we were doing the strategic national stockpile and we needed a lot more medical staff, the state tracks that and can provide those resources if needed. They also track all the resources that are out there, things that are being sent. If somebody needs a generator and the state can provide that for them, they will track that resource. Any kind of incident-specific item that a health department might need for an incident, such as vaccines. The state will track all that if that's sent in. And then really any unmet need. If a local health department needs something, they don't have it, nobody in their region has it, they can ask the state to provide that asset. If the state doesn't have that asset, then the state can ask for the federal level to come in and get that asset for them. All right, talking about resources, it's very important, and Tina touched on this very briefly, that it's important to know how to get your resources. All events start local and they end local. So you want to try to get your resources from your local resources first, from individuals like your county emergency manager or an entity or hospital or long-term care facility within your area. But it's important to know when you're requesting those resources to make sure that they understand what kind of resource that you need. You need to be very specific. What are you wanting? What are you trying to do with it? How long are you going to need it for? And then any kind of details that you know about the type of material or equipment that you're requesting. It's also important to know what the state has. The state has a lot of personal protective equipment for the health and safety of responders. They also have a lot of medical surge equipment that can be borrowed, trailers, tents, so on and so forth. And then we have a lot of communication equipment, satellite radios, My Talks, ham radio equipment that you can ask and get from the state.
When you look at resources, I think, and you start talking about this, I think one of the things you have to ask some questions. The reason why, it's not that they don't want to get you what you're wanting, they want to make sure they're getting you exactly what you're wanting and you're needing.
So Tina, you want to go over kind of like an example of that? So if I said, Tina, I need a tank, is that enough information for you?
Well, it can mean a lot of things to different people. So you may go, what does it mean to you if I say I need a tank? Give me a tank.
An army tank?
Okay.
Fish tank.
Oil tanker?
Okay, so public health may actually need a potable water tank so that we can take water to individuals who need it. So there are a lot of different things that you can come out of just one word. So that's why you have to be very specific. If you're needing medical equipment, exactly what type of medical equipment. There are a lot of different types of oxygen tanks. There are a lot of different types of trailers. So you want to be very specific when you're requesting materials. Thanks, Tina. All right, tracking cost. This is one of the most overlooked parts of a disaster because of the nature of who we are as individuals and being in public service. We want to help individuals immediately. If we see a problem, we want to try to fix it. But it's very important so that we can continue to help people in the long run that we track what kind of money that we spend so we can get our money back to help in another disaster that might occur. It's very important to start this immediately. Once an event breaks out, once you have some kind of disaster or event or even a planned event, you want to make sure that you start tracking and keeping the receipts of everything that your health department is spending their money on. And someone has to be assigned that task. That can't just be willy-nilly. It's definitely got to be someone who's very good at counting those beans and enjoys looking at numbers. You have to track every expense, all your time of your employees, the equipment that they're using, any contracts or subcontract employees that you might have or have to bring in, subject matter experts, people from other states, other local health departments, any partnerships that you have, and then all of the details. If you move a location, where have you moved to a location? What activities are going there? What type of equipment got moved there? And anything that needs to be reimbursed in the long run. Volunteer hours can be reimbursed. Those have to be actually tracked also. So it's very, very important. There are FEMA trainings, if you're interested, if that's something that you would like to do at your local health department, that you can request to take so that you'll better be able to actually do that task for your local health department. Yes?
When I respond to an event, do I use a different cost center like I do when I go to training?
Want to answer that, Tina?
Most likely you will. But what you're going to want to do is talk to your supervisor and see what that cost center is going to be. A lot of times, depending on the incident, it might be a completely different number per incident. So again, go back to your local people, find out what they want you to do. But definitely that's something you need to ask about right away, because someone might not even thought, oh yeah, we need to,
Right.
Everybody needs to go to a different cost center so we can track this in the long run. It's a good question.
All right, getting back to normal. There is no rest for the weary. An event, even a planned event, takes a lot of time and effort to get things pushed out and then to pull all those things back in. If it's an event where a shelter has to be open, that shelter has to be closed. All those people have to be returned. If they're displaced individuals, homes have to be found for them. If it's an individual with some kind of medical need, we need to find a place that can meet those medical needs. And then the shelter has to be closed. If there's anything broken that has to be fixed, all of that has to happen. Also, the health department staff have to go back to their normal jobs. All of those costs for that bean counter, all of those receipts have to be rolled up and those all have to be turned in. And then during the recovery phase, what was normal before may not be normal now. There may be different jobs that have to occur. There might be some new jobs. There might be some restructuring within the health department for the new job. There might actually have to be a new building built, so that takes a long time. People may be working at a totally different location or trailers on the parking lot of the building that they used to work for. And then paperwork does go on for a long, long time. There are a lot of things that you have to do to get those reimbursements. And there's usually a division that's handling all of that. But if you're ever asked to turn anything in, you need to try to do that in a timely manner. And then all of the people and the stuff that was borrowed, any of those resources that you borrowed from another local health department, from another state health department, or even outside of the state, those all have to be returned back to their original owners. Yes, sir.
Does the health department help with shelters?
That goes back, you're going to have to go talk to your local planner, your local preparedness staff, and see what your policies and regulations are. All the health departments are required to do surveillance in a long-term shelter. That will probably be your EPI and your environmentalists going in and checking everything out. But in addition to that, some health departments do have more responsibilities, but that just goes back to your local policies and jurisdictions.
All right, what you should know up front, it's very important when you see your health department preparedness staff, you see them oftentimes working with a lot of different individuals within the community. You'll see them working with people from the healthcare coalitions, you'll see them working with local schools, public libraries, just a lot of different entities, because they need to know all the different people within the community that could be a very viable resource during times of disaster. It's also important for you, again, let's talk about that again, that Department of Operations Center, that State Health Operations Center that's now called. It's important to know how to get a hold of that email and be able to contact those regional preparedness coordinators if you need something within your region. It's also important, like Tina talked about that COOP plan, it's important for you as a staff to actually go and find where your local COOP plan is stored and actually to read that document and to get yourself familiarized with that document. And know, what are you supposed to do if there's a power outage at your health department? How do you evacuate for a fire? Where do you go in your health department for a tornado drill? Those are all very important, and it's important as you as a staff member to be aware that you have to take the initiative to get to know those things. It's also important to know about that cost center if there's a disaster, or any kind of receipt or time ticket that you've got to turn in if you're working outside of your normal environment. It's also important to know how your local health department, how their organizational chart is structured, who your supervisor is going to be, and will that change in time of event or a disaster. It's also important to know where your resources are. What does your local health department have? What kind of resources for disaster do they have? What kind of resources does your region as a whole have for disasters? And then to know the types of items that the RPCs can get for you, those regional preparedness coordinators from the state, and how you get them. And then just really knowing what you have available to you within your region. And then putting it all together, this is a pretty good job description of what your local preparedness division does for you. On a daily basis, they're working on plans. They're looking at worst case scenarios of things that can happen within your region. And they're writing plans and working with those local public health preparedness staff to work with all those people within your region to write that down and to get that all worked out. And then when they have a plan written, they come up with a training to see if what they've thought through will actually work. And so then they get everybody together and host trainings on maybe how to use a particular type of communication equipment, maybe how to use a particular type of tracking system. And then once they've taught the local health department staff how to do that, then they'll put an exercise together and bring everybody together and actually practice those skills together. And then after that's over, they'll do what's called a hot wash or an evaluation of the exercise. And that's where you get to put your input. Did you feel comfortable with what they taught you? Did they, through that training and through that planning, were you equipped enough to be able to handle that situation? And if you weren't, they'll go back and they'll train you again, or maybe take the training a little differently so that it's better for all staff. And then they'll also continue to network within the community and bring in different partners. They'll also work on getting grants and finance brought into the preparedness department. And then also work, usually during September, it's Disaster Preparedness Month, and they'll really provide educational information to all the local health department staff about how to better prepare themselves, and like Tina said, make that family preparedness plan.
So today what we're wanting you to get across to you is, one, there is a branch in public health at the state health department that is called the preparedness branch. There's several people that work under that branch, and a lot of that money came from federal dollars so that we can be prepared as a state to handle any kind of event that comes along. And a lot of that is concerning the healthcare system. If you think about it, when you think nationally across the United States, if something happens in a community that is a health issue, what government agency that takes care of health issues is in almost every community? Health departments. That's the reason why a lot of this has happened in the health department. It's only come about after 9/11 that we made a lot of these changes, and public health has taken on more of this role. We've always been there helping disease surveillance and all of that, but now they've pushed us a little bit further to do a lot more. And so we wanted you to understand that. In addition to that, there's local money given to the local health departments so that they can be prepared to help in their community locally. So today, that's what we talked about. We wanted you to understand what is all of this? How does this all fit together, and what are we doing? And when you're asked to do these classes, or you hear that term ESF8, you'll have an idea of what that means and how you fit into the picture. All right, that's everything for today, and I appreciate your time. If you have any more questions, you want more information, go back to your local health department and talk to your preparedness planners. Just find out who that is and get to know them, and they'll be glad to help you with any questions you have.
Thank you.
Thank you.